Welcome to week 6 of your Pharmacy Career Planning 2 course. This week we're going to be covering Chapter 11. And Chapter 11 is all around nuclear pharmacy. Nuclear pharmacy is something probably totally different than you've ever experienced. It is definitely not the same as regular acute care pharmacy, hospital pharmacy. It is got a lot of other components that make it something completely unique and special. So we're just going to kind of look at it at a high level on this particular presentation, but you can go through the slides and obviously the textbook as well to kind of get even more detail about it. So when we talk about nuclear pharmacy, we're talking about the pharmacy that takes care of any type of radioactive materials, basically, where they do compounding, they do dispensing, but essentially everything that they do is considered sterile compounding, so the sterile practices have to be implemented. And there's two basic types of nuclear pharmacy. An institutional nuclear pharmacy is within the nuclear medicine department. So in other words, it's actually in the nuclear med area of the hospital, and it's its own pharmacy. And then we have a centralized nuclear pharmacy that operates out of a central site and services a lot of different customers in different locations. So what you might see is a nuclear pharmacy within the central pharmacy and sending it out to different parts of the hospital, or even in some cases other locations, although that would be not quite as common. The textbook goes on to tell you a little bit about radioactivity and what is involved there. But the idea is that when we're talking about radioactive materials in the pharmacy, it's a drug that releases some sort of radiation within the body. And typically these are used for different types of diagnostic tests. I actually just had one myself called a HIDA scan a few months back, and basically that particular one was used to determine whether or not my gallbladder was acting properly. So it actually has radioactive material that's injected directly into your veins, and then they put you into a machine, and then the machine is able to detect that radioactive material in that scan. So that's how that particular one works. There are some reactions to radioactive materials, but they're very, very small amount that you're getting, so that the chances of having a reaction are very, very slight. Usually it's just some sort of a sensitivity, maybe, itching, hives, that kind of thing. There are some medications that you might be taking that could interact with the radio pharmaceuticals. So, you'll have to make sure that you provide that information to the pharmacy so that they can make sure that there is no reaction that might occur because of the interaction between those two medications. The textbook then also goes on to talk about the different elements of a nuclear pharmacy, what it might look like, who works there, what are you going to do when you're in there, all of those types of things. So again, it's, a lot of it has to do with just the fact that it is radioactive material. So because it's radioactive material, there's specific things that you have to do with it. For example, because of this type of material has a very short half-life, that means that it's, we don't keep a lot of stuff on hand because it's going to lose its potency very quickly. So the inventory changes on a frequent basis. You're also going to look at some of the different types of equipment that you're going to be using, as well as how the pharmacy is designed. When we talk about equipment, mainly we're looking at things like, anything and everything that has to do with safety. So this is where you're going to be using the hood and all of those other things that protect the pharmacist or the pharmacy technician as they are preparing these different types of medications. So as you go through and you look at some of the different tasks that you might complete as a pharmacy tech within a nuclear pharmacy, let me know if there's anything that you have questions about. It is a very different and exciting type of pharmacy. A lot of regulations around it. You have to make sure you're following USP 797 and all that good jazz. But it can be very, very interesting and very different than a traditional setting. So hope you all have a great week, and let me know if I can help you with anything.